hypertension, which is high blood pressure, arteriosclerosis, heart failure, stroke, renal failure, which is prevalent in those of us who have type 2 diabetes, gallbladder disease, and cancer. So obesity contributes to this disease, but so does diabetes. So, I mean, basically, they're like a married group or a prom date, because most of the time, one doesn't exist without the other. There are rare occasions with people who are much smaller than, like my stature, who do have diabetes, but for the most part, the majority of the population is obese. Obesity, next to sugar, is probably the second largest contributor to the development of diabetes, and just like the steady rise in sugar consumption reflects the increase in type 2 diabetes, so does the steady rise in obesity. According to the Center of Disease Control, we are eating ourselves into a diabetes epidemic. See how heavy the young boy is? What is he? Those narches. And this is right here. I mean, not the fact that he's a brother, but excuse the fact that he is a brother, but I was trying to find a better picture, but my main focus was this right here. Why would you want to put something of that magnitude inside of you? It just profounds my thought that you would even want to eat something of that size. And, unfortunately, these are the habits that this country has gravitated towards. It's like the larger the portion, the better we are. And it's making us sick. In 1993, 13 years ago, the International Diabetes Foundation stated that diabetes and obesity have become the biggest public health challenge of the 21st century. So in 1999, they were looking at the different trends and seeing that people's weight was beginning to increase. They were also doing studies on children at that time, and they were seeing that by the time 2020 rolled around, that 2 out of every 3 child that was birthed in the year 2000 ended up with type 2 diabetes. At that time in America, diabetes affected 16 million people, 6% of the population, but it was up from 9.6 million people, an increase of 40% in just 10 years. In that same time span, from 89 to 99, the obesity rate climbed from 12% to close to 20%. Take a look at these maps. Okay, these are the maps that the CDC had published over a 19-year time span, and look at how dramatically the obesity rate climbed. That was in 1991. 10%, less than 10%, is light blue areas. 10 to 14% is the middle blue areas. 15 to 19% is the dark blue areas, and of course the white is no data. That's 91. 2001 came up with a new color. Less than 10% it doesn't even exist on the map anymore. 10 to 14%. 15 to 19% is here. 20 to 24%, and 25 to 29% is down here in what's that, Louisiana? Or is it that's Alabama, right? Geography is Alabama? Yeah, it's Alabama. Florida, Virginia, Maryland is on the map there somewhere. They up there. I guess they combine Maryland and Virginia together. And of course, you got the upper states, New York, and all that. Check this out. 10 years later. 2010. They even got Hawaii in the mix now. 20 to 24% too. Back in 1991, Hawaii wasn't even on the map. Look at the size of obesity. That's incredible. What is really staggering is that the obesity rate continues to climb out of control and is paralleling the increase in diabetes. Even more alarming is that the people of type 2 diabetes, about 80 to 90% are also diagnosed with What effects does it have on your body? Lifespan expectancy is shortened to 5 to 10 years. And these are old numbers. It contributes to 160,000 deaths a year, 2 to 12 times the risk of heart disease, 2 to 4 times the risk of stroke. Number one cause of blindness in adults. Factor in half of all foot and leg amputations, over 60,000 amputations yearly in diabetics. In any given year, over 50,000 diabetics are either on dialysis or have a kidney transplant due to diabetic neuropathy. Cause of peripheral neuropathy, increased risk breast and uterine cancer. Even more important than knowing what you have, that you do have diabetes, is knowing what it can do to you. And I mentioned about the thirst and have the feeling of nausea, want to throw up, headaches, tired, weak, cramps, dizzy. It's a serious condition. Diabetes is a disease that is systemic, meaning that it can interfere with the functions of many of the body's organ systems. This is what it can occur. Neuropathy. That's when you feel like you have needles sticking in your feet. Retinopathy. That is the effect of the diabetes affecting the small capillaries in the eyes. The eyes become damaged. They call that retinopathy when the retina starts to get to the point where it's not functioning anymore, so you go blind. Cardiac or heart disease. Osteoporosis. Kidney disease. Alzheimer's. They've linked diabetes to Alzheimer's. Cancer. This is a form of pancreatic cancer. There's your tumor down there. Depression. Foot lesions, leg lesions, or skin ulcers. I didn't want to gross anybody out because there were some nasty pictures on it. I didn't want to gross people out today. And if you're male and you have a serious issue with diabetes, you can become impotent. What can you do about it? I like this little cartoon. Dude is sitting there, I can't exercise. I don't have the time for it. The dude, the doctor said, what fits your body schedule better? Exercising 1 hour a day or being there for 24 hours a day? I think that's just the mark. The first step in diabetes is rebalancing your health from the imbalanced effects of diabetes. It is first to accept the fact that diabetes, specifically non-insulin dependent diabetes, starts primarily on the gene. As I said, I'm not going to touch type 1 diabetes because it's all altogether different animal. As we speak now, they're trying to change the name of type 1 diabetes, type 2 diabetes, from type 2 or non-insulin dependent diabetes to syndrome X. What I mean by syndrome X is because of the metabolic process, the insufficient metabolic process that takes place in diabetes, type 2 diabetes. They want to get away from the term diabetes altogether because it's not really the same as type 1. More research is beginning to support the argument that diet and lifestyle play a major role in diabetes cases. A diet that is high in refined sugars, unhealthy fats, animal products, and low in dietary fiber, like that of the so-called standard American diet, tremendously affects blood sugar levels. Look for the unhealthy foods in your diet and start to eliminate them immediately. That's the first step. After you acknowledge the fact that you do have it and you want to get rid of it, by the way. In the medical profession, they tell you that there is no cure for diabetes. Every time that there's a disease out, the CDC, the AMA, which is the American Medical Association, the Food and Drug Administration, and other government agencies sit down and decide what it is that we can mark or make a marker of what is a cure for disease and what isn't a cure for disease. And later on down the road, I mean, as I continue to do lectures and things like that, I'll probably start to look at how they manage disease and how they communicate that information out to the public. But just for the fact that diabetes alone, they have decided that there is no cure for diabetes. My philosophy is that diabetes is not a disease, it's a condition. And my wife and I have this topic quite often because she has issues with the same disease. But I say it's a condition because the terminology of disease does not set the same terminology of what diabetes, type 2 diabetes is. And because you cannot cure a condition, there is no cure for a condition. You can cure a disease, but you get rid of a condition. You have a swollen ankle or a broken bone. That's not a disease, right? You have a cut finger. It's not a disease. It heals up on its own. It's a condition. A disease, in my opinion, has a whole different set of medical markers that take place that establishes what a disease is. Cancer is considered a disease. Lupus is considered a disease. And so on down, so on and so on. But getting back to diabetes. These are the foods we need to start taking a look at. And anybody who's diabetic, and you go to a doctor, the doctor tells you to take, that it's okay for you to drink soft drink products or any type of products as long as it's diet related or diet soda, diet fruit drinks, or whatever. Stay away from that stuff. Diet soft drinks have a component in it called saccharine. Saccharine's are poison. They have related the saccharin in the foods that they replace the natural sugar with. They put it in a diet drink, and the studies have proven that in lab rats, lab mice, lab rats, whatever type of subject that they're doing these studies on, it's causing cancer. It's causing all forms of cancer: brain cancer, kidney cancer, prostate cancer, urinary cancer. I mean, it's also has been linked to the contributing to Alzheimer's disease too. So even though it says diet, and when I was listening to a lecture online where it says diet, the first three letters in that word, DIA, is basically if you keep drinking this stuff, it's going to happen to you. Unfortunately, as I said, I mean, I've been experiencing so many of these issues in our community and in our family. And just a few years ago, my father, my wife's father, succumbed to pancreatic cancer. But he had, you don't mind me telling the story. He had diabetes that was pretty bad. And one of the things that we used to get on him about was that the amount of Diet Cokes that he drank. I mean, he drank cases and cases of Diet Coke. His daily breakfast was a Diet Coke and donuts. That was his, and he didn't understand why he had diabetes. And we would tell him, look, Dad, I mean, why do you keep drinking this? Well, the doctor said it was okay for you to drink. The doctor's okay. If the doctor's telling you that it's okay for you to drink, and you're seeing the effects of what it's doing to you, why would you continue to drink? We need to start taking the responsibility of our own in our own hands, and we need to start communicating back and forth with the doctor. What I call a good doctor is someone who's willing enough to sit down and have a consultation with you. Sit down and talk to you and say, well, I'm giving you this medication, but right now we're trying to determine what is the best means of healing your body. If they're telling you that I'm giving you this medication so that I can make you feel better, you need to get up out of that office and you need to walk away, because when you feel something, that's nothing but a sensation. I can feel this book with my fingers. I can feel this laptop. Feeling is a sensation. If you're feeling, if they give you medication to feel good, the only thing they're doing is shutting down the symptoms that's created that disease. And those symptoms have been placed in your body by the Most High, who has more intelligence than anybody walking on this planet. The Creator created this body with every intelligence in it. The cell knows that when it is off balance, it gives you a signal immediately. Even before you can go to the doctors and test, or take a test that they're giving you, your body has already told you that you're out of balance. So the symptom has been